So we're going to do a live Q&A and help you all try to decipher all the government acronyms out there: AEP, IEP, SEP, GEP, guaranteed issue, all the rest of it. So if you got any questions about all things Medicare, Part A, Part B, Part C, Part D, guaranteed issue, Medicare supplements, this is definitely the place for you. If you're watching this on a recording later, make sure you save, subscribe, and that way you can find us here in the future. We've got Ari from Chapter is going to help us out and answer a bunch of questions. How you doing today, Ari?
Doing great. Thanks for having me, Dr. Ed. So excited. We have a little over 2 weeks to go.
Yes, in this thing called the AEP. What is it, about 53 days? So millions and millions and millions of Americans have to see if they're in the best plan for the following year, in this case 2026, and they have 53 days to do it, and y'all are helping them out with that. And so how's everything going? Are y'all getting any sleep?
Here and there, for sure.
Here and there.
We're just excited to help as many people as we can. A lot of them have been your viewers, so thank you to all of Dr. Ed's viewers that have called us during these 53 days. And guess what? We still have 2 weeks to go. So
Yep.
If you would like to take a look at your coverage for 2026, we'd be delighted to help you. You can also visit Medicare.gov, of course, and shop your options there.
Perfect. Okay. And then we've got some questions already, but so what is the deadline for those people that are tuning in just to hear about the deadline? So we're in what it's again, there's AEP, EEP, GEP, IEP, but we're in the AEP, the Annual Enrollment Period, which lasts from October 15th to December 7th. Who needs to do what, why, how, when, what for, how? I think I already put 4 or 5 W's and an H or whatever it was. Yeah, that.
The annual enrollment period, which is what we're in right now, and it ends December 7th, is the time for those who are already on Medicare to review their coverage for the upcoming year. So you have until December 7th, if you're already on Medicare, to review your coverage. And what you can do during this time frame is, if you've been on a Medicare Advantage plan, you can compare your options and choose a different Medicare Advantage plan. Alternatively, you can return to original Medicare and potentially obtain a Medicare supplement and a standalone drug plan. And of course, if you're on a Medicare supplement plan already, then this time period is when you ought to review your drug coverage for the upcoming year to make sure that you're not overpaying for your prescriptions.
So for Medicare, if you're on a Medicare supplement plan, what do you always say about Medicare supplement? Date, marry, or whatever? What's that phrase you always use?
Marry your Medigap, date your drug plan. The time for dating your drug plan is right now, and you have until December 7th. You can shop your Medigap plan at any time.
So if you have a Medigap, also called a Medicare supplement, an F, a G, or N, or whatever the case may be, 365 days of the year, you can switch that. Depends on your state and your health condition. Yeah, potentially your state and your health conditions. You could possibly switch that to another plan and save some money. And speaking of money on that, Paul asks, is there an average premium cost for using a supplement plan G? I'm trying to get a total cost, including Part B, which will be $202 next year. Yeah, $202.90 for 2026 is the Part B premium that everybody has to pay, unless you have someone paying it for you. Either a Medicare Advantage plan is paying part of it, or Medicaid, whatever they call Medicaid in your particular state, is paying for it. But everybody essentially has to pay for that if they want Part B. So what are we looking at average cost for a supplement G?
Depends on what state Paul is located in. In many, many states, Medicare supplement is eminently affordable. Just depends on the state you live in. It depends on, in many states, whether you're a smoker, and also whether there are any discounts. For example, do you have a roommate? Do you have a spouse who's signing up for the same coverage? And of course, it depends on, for many carriers, your age.
Yeah, I kind of throw out from my personal experience, probably about it. Again, it's completely different. If you're in New York, it's completely different. But G, about 120 or so average, what I've seen personally. A plan N is usually about again, my personal experience, about 20% cheaper than a G.
Yeah,
So,
even 30% in some states. Plan N can really be a savings. If you're on the fence about whether to choose Medicare Advantage or a Plan N, which is Dr. Ed's preferred Medigap plan letter type, then that's absolutely something we could help you walk through and do an analysis of which one might be more advantageous for you for the upcoming year.
perfect.
Either way, though, you really want some type of additional coverage, because if you just have original Medicare, which is Part A and Part B, then you owe 20% out of pocket, and there's no ceiling on that 20%. So if you live in the Chicagoland area and you're planning to get a knee replacement, it's a $50,000 procedure there. You'd owe $10,000 out of pocket if you just have original Medicare. Yes, thank you so much for this chart.
Yes.
So here you have two options for additional coverage. Option one is a Medicare supplement plan, which is also known as Medigap, potato, synonymous terms. This is the most comprehensive and flexible type of coverage. If you go with Medigap, then you would just want to add a standalone prescription drug plan. Option two is Medicare Advantage. So whether you choose option one or option two, it'll provide some out-of-pocket protector for you, which you don't have under original Medicare. You also want to make sure you pick up drug coverage. So if you go Medigap, you choose a standalone prescription drug plan, unless you have creditable coverage, for example, through the VA. If you go Medicare Advantage, you'd want to make sure that you evaluate your options for a Medicare Advantage prescription drug plan, so that way it's bundled with drug coverage.
And for those with Medicare Advantage, I put together the 7 Ps here. If you're going to be reviewing your plan, doesn't matter who you do it with, do it. If you've got someone that you know and trust that helps you with your Medicare Advantage plans every year, definitely reach out to them, but make sure you're doing it right. You're asking all the questions. And this is what we put down, the 7 Ps here, is have your current plan available just so they can compare apples to apples for next year. If you have a particular provider or providers you definitely want covered for next year, you make sure you have that list of those people you definitely want covered. Your prescriptions, whether they're extended release, tab, gel, it makes a difference. A particular pharmacy if you want to use, priorities if you need more dental, vision, and obviously someone said, Ed, you should change the 7 Ps to prices. Yes, but coverage is also important. But prices, yeah, people say, well, the most Medicare Advantage plans are 0 premium. You shouldn't have to worry about prices. Well, that's not. A lot of them are 0 premium, but there are price differences, right?
Yes, because Medicare Advantage is pay-as-you-go insurance. So Medicare Advantage is managed care. It's subject to a private insurance company's terms and conditions. It's subject to the private insurance company's network restrictions. You want to make sure that all of your doctors are in network. If they're out of network, you either won't be able to see them or you'll pay more when you see them, if you're on a PPO, for example. Medicare Advantage is also subject to prior authorization. And in 2023 alone, there were over 50 million prior authorization claims. So that means the insurance company gets a veto over the care that you and your doctor think that you should receive. So there are trade-offs to consider.
Yeah. And then speaking of the would you say 50 million prior authorizations, that's where the persistence comes in. The other 365 days of the year, the actual 365 days you have that plan, you just have to stay persistent. If they deny you, you fight. It's you paid for it. You're saying, well, no, I didn't pay for it. I'm paying 0 premium. No, you paid for the money. As everybody's father always says, money doesn't grow on trees. It comes out of our pockets. So you're paying for essentially the Medicare Advantage through regular taxes. You paid for it for decades through FICA, Medicare tax, and general taxation as well. So you're paying for it. So if you get denied, they give you a hard time about a particular drug, or you lose your doctor, make sure you fight. And that's one of the reasons my son and I reached out to Chapter, because y'all have an awesome team that helps fight for that. And we just had her on a few days ago, Sarah, and she was awesome.
That's right. Our member advocate team will help you fight. So it's not just on you. If you need a prior authorization, we will reach out to your doctor's office and work with the insurance coordinator in order to help you get it. If you misplace your ID card, you don't have to call the insurance company. Instead, you can call us and we'll help you get a replacement. If you have a question about a copay at the pharmacy, you'll call us and we'll make sure that you're paying the appropriate amount under your plan.
Yeah, it's you see a lot of these doctors on social media, and they just have a tough life. You know, they got into the profession, you know, to help people because they like medicine, and I guess they like math and anatomy and biology, which not for me, but anyway. But you watch these guys and gals on social media, and they spend just a crazy amount of their day calling up insurance companies and filling out paperwork and talking and said, no, this person needs this because of this, this, and this. And they, some of these doctors, unfortunately, just don't have time for that. So you need kind of a fallback position, and Chapter helps with some variations, some of those prior authorizations, right?
That's right. That's exactly right.
All right. So let's see what else here. Someone's asking about billing. I've lost the question here, but someone's asking about billing. They're signing up for Part A and Part B. When will their billing start for Part B? If you're already receiving benefits from Social Security, retirement benefits, disability benefits, spouse benefits, surviving spouse benefits, it'll come directly out of your check. Social Security always likes to take it directly out of your Social Security check. If you're not, then you can set up a monthly thing where they can deduct it out of your bank account, or they can invoice you what is every 3 months, and make sure you pay that invoice.
That's right. When you first start Medicare, if you're not yet on Social Security, you'll receive a paper invoice for the first month of premium. If you're a high earner, they'll then send you another invoice 2 to 3 weeks later, because they'll check your tax return from 2 years ago. And if you've had a change in life circumstance, you can actually appeal the high earner determination. And that's another way in which we can help you save.
Yeah, that's the IRMA, the extra Part B premium and Part D premium, if you have a life-changing event. And unfortunately, the sale of a home is, yeah, that still counts, unfortunately, as your adjusted gross income. So you can appeal that extra income because you sold a house. You can appeal anything, but those never get approved. Unfortunately, Congress didn't make an allocation for those.
You need one of the 8 life-changing events. The 2 most common are work stoppage or work reduction. Sadly, the 3rd most common is divorce.
Yes, yes.
Great divorce.
So what about guaranteed issue? So a lot of people, close to maybe 1 million or more, over 1 million people, are going to get a letter that from their Medicare Advantage plan already received it, that
a lot
their
of your
plans
viewers
have been approved. Yeah, their plans have been not approved, but
are ending. Their
closed,
Medicare Advantage
ending.
plan is ending. So if you received a letter from your Medicare Advantage plan that said that the plan is no longer being offered, then you are entitled to a guaranteed issue right to choose Medicare Supplement without any questions about your health history. So in 46 states, you have a one-time opportunity to choose Medicare Supplement. And it's when you first start Medicare. It coincides with the 6 months after you start Medicare. But if your Medicare Advantage plan is being terminated, then you have another shot. And this is your golden opportunity to choose Medicare Supplement without any questions about pre-existing conditions or your recent health history.
All right. So if that happens, reach out to y'all, and they'll definitely see if you can find another plan. And people also, so people that lost Medicare Advantage, I talk about this every time I do a live Q&A, because I noticed last year there were a lot of people, not as many as this year, but there was a lot of people that lost their Medicare Advantage plan, got their ANOC, their annual notice of change, that said, yeah, sorry, we're leaving your state, we're closing down, you know, you're going to have to go find something else. And people didn't understand the letter, they didn't get it, whatever the case may be. And then January and February, they come in here and they say, Ed, I just went to my doctor and they said, I don't have a Medicare plan. I've had the same Medicare plan for 3 or 4 years. You have to find something different. If you don't, then you're going to, and if something
you're going
bad
to owe 20%
happens,
out of pocket.
Exactly.
And
if
sky's
something
the limit
bad
on
happens,
that 20%. Yeah.
Exactly.
As Kobe says, our CEO, if you have a multi-$1,000 bill, that can be thousands of dollars out of pocket.
Yep. Yeah. Yeah. Some people, they're lucky. They go into their regular doctor, and the doctor, before anything, they spend any money, the doctor says, or the person at the front says, yeah, this plan has been canceled. You need to find something else, and then reschedule appointment for next month in February when you find a new plan. But if something happens in January, February, you have to go to the emergency room and you just have to go, period, then you're going to be stuck with that bill, unfortunately. So if you know anybody, yeah, make sure they've reviewed their plan for 2026, or if they do have a plan. So, Elena, thanks to Dr. Ed and Ari and the team for guiding me through Social Security and upcoming Medicare journey. I'm sharing the information. Perfect. Yeah, please share. A lot of people are having issues out there. Ari from Chapter. So,
Thanks, Bella. I hope,
yeah,
Bella, I hope
Bella's
you're
awesome.
feeling better.
Yes, she's out of the hospital and back back to her old self, helping people out. Awesome. So there is also, for those people that are coming new to Medicare, just turning 65, or they were on disability for 2 years, this whole December 7th deadline, no issue for them, right?
Right. The December 7th deadline is for people who are already on Medicare. If you're just turning 65, then you have a separate eligibility window to choose coverage.
So that is for Part B, you have essentially 7 months, 3 months before the month, and then 3 months after. But with the way Social Security the staffing is being cut right now, I highly, highly recommend that you do it as soon as possible. Do it as soon as possible. For those people that are losing their job and therefore their health insurance, and they find out like now towards the end of the month, you got to go down there and essentially don't just send in the paperwork and think it's going to be taken care of in 2 weeks by December 1st. In that particular case, I would definitely go down there personally and kind of push your way through the guard. Not physically, but what you do is you say, hey, I'm losing my Medicare. It happened all of a sudden. I need something to happen. I need Medicare Part A, Part B, and I need to get a supplement or a Medicare Advantage plan within the next couple of weeks. If I don't, I'm not going to be able to go to the doctor. I'm not going to be able to get my medicine, and it's all going to be y'all's fault. And I guarantee the guard, once they hear a story like that, they will let you in, and they should take care of you. If they don't, you come back here, and then we'll come up with another plan.
Yep. And I really have seen that the Medicare applications are being processed expeditiously. I've seen people have sometimes a 36-hour turnaround, even when the government was shut down.
Yeah, if you do it online, if you're filing for Part A and Part B, then it's pretty much automatic. There's no issue with your work history and stuff like that, because you're not getting paid benefits. So if that's the case, then it's a whole different issue that someone actually has to look at. But for the Medicare only, if you're insured for Medicare and it's your turn to sign up for Medicare, yeah, that's pretty much automatic on the back end. So those are pretty easy. It's the people that have to do the 40B and the 564, those other two documents that, send it or mail it or fax it into the local Social Security office. Those are the ones where a human being actually has to process those. And yeah, it's
and just
Bob
be
wants
prepared.
to know yes.
Yeah.
Yes.
L564 is a one-page form. You fill out section A, your employer fills out section B, the company official signs at the bottom. And that's what you upload to Social Security. And as long as you have that one-page form, it's going to be a straightforward, smooth sailing process.
Yes. If there's someone on the other side to put that into MCS. Yeah, it's good. That's a manual process. Anyone know Chapter's hours? Do you happen to know Chapter's hours there, Ari, from Chapter?
Yes, Monday through Friday, we are 9 a.m. Eastern to 9 p.m. Eastern. And then Saturday and Sunday, I believe it's 10 a.m. Eastern to 8 p.m.
Okay. I got
And
9 to
I've
9
also
on Saturday
noticed.
and Sunday.
Oh, is it 9 to 9? 9 to 9.
9 to 9 Saturday and Sunday. But are y'all going to be open Thanksgiving?
Yes, we are.
Oh, really? Wow. Okay. All right. Chapter helped me understand that the plan I already had was the best for me, so I didn't need to make any changes. Thank you so much. Yeah. So That's awesome. And that's peace of mind that you're all good. So you reviewed your plan. You did essentially what the health insurance companies don't really want you to do. They don't want you to review the plan. They want you to throw the dice and let them make, the changes under the hood. But in your particular case, you were the best particular plan for your particular area, for your particular needs, and you didn't have to do anything. Let's see. Oh, I'm currently waiting for a chapter to call me back to discuss my options on D and a Medicare supplement plan. So time travel there. So y'all are still pretty much crazy busy out there, right?
Crazy busy. I'm double checking on Thanksgiving. I believe we'll have limited availability on Thanksgiving. My
Okay.
recommendation though is the earlier in the day that you call, the easier it is to get through. So if you call right when we open, oftentimes you can get right through in the morning.
Okay. And that's about 8 or 9 o'clock every day of the week, East Coast time, right?
Yep. And
Okay.
I believe I know I said 9 a.m. I think Monday through Friday, we're actually 8 a.m. Eastern. We're open at 8 a.m.
8 to 10. Yep. Okay. Perfect. Yeah. And if you're having a hard time, see the issue with the way the whole system is run is, chapter and every Medicare insurance place out there, majority of their time that they need to help people is right now. What AEP is 53 days or so, 53, 54 days, if you included Thanksgiving. So you got millions and millions and millions of people that need service within those 53 days. And y'all could hire, 1,000 more Medicare insurance people, but y'all go through a bunch of training. So you take a lot of time training these people and making sure you're finding the right people and everything. But you could hire 1,000 more people to deal with that 53 days. But what do you do with that extra 1,000 people for the other 310 days?
It wouldn't be the right thing for the advisors and their family.
Yeah.
Instead, we only hire the best of the best. So for up until the annual enrollment period begins, we're spending so much time trying to identify who are the best advisors in the country. And then those are the people that we hire. Their final interview is with our CEO. And then we put them through a rigorous training and ramping program. And only then do we allow them to help you.
Perfect. Yeah. I know y'all go through, and we've had nothing but positive when people have talked to someone on your side. I've sent a bunch of people have sent me emails and said, yeah, I called chapter. I got through right away. It took me about a day or so to get through, but once I got through and talked to the person, y'all got some extra outstanding staff there. So we really do appreciate y'all taking care of our community. I really do appreciate it. Smiling, I found a strange company plan G, $164. Yeah, it really depends on a bunch of factors, but for a Medicare supplement plan, a plan G is a plan G is a plan G. Pretty much doesn't matter where you are. There's a couple of states that don't have a plan G. They have something different. But they're all the same.
That's right.
The only difference is price.
Under federal law.
And the only difference is price, but there's also like 3 different pricing, and don't always fall for the lowest price, because people say, well, there's one that's $164, but there's another one that's $64. And since they're all exactly the same, why would I get 164 when there's one for 64? Why would someone be wary in that particular situation?
For well, as you mentioned, plan G is plan G. To your question, what was your question on the pricing?
So why would someone go with a plan that's a little bit more to start with? There's historical pricing. These particular companies, they might get you in for some type of low ball, and then you can't switch out of there, and they raise the prices considerably, right?
So what we look at is the 20-year sum of premium index. So that takes your current age, it adds 5 years, 10 years, 15 years, 20 years, and then we sum those premiums together in order to provide a basis to discuss provide a comparison between different options, because Plan G is Plan G, just as Plan N is Plan N, and the hospital and medical benefits don't vary under federal law. But we want to set expectations as to how an insurance company might raise prices over time using today's pricing information.
Perfect. All right. Let's
And
see.
Dr. Ed, we are closed on Thanksgiving. I just confirmed.
Okay, you are going to be okay. You're going to be closed on
Everyone
Thanksgiving.
in the chat who was pushing for us to be closed on Thanksgiving, you win.
Yeah, I see music rocks my world says they shouldn't work on Thanksgiving, and yeah, Bonnie says take off of Thanksgiving. So I think actually last year I did a live Q&A on Thanksgiving because I figured, we were so politically divided out there, and I knew a lot of homes were politically divided during Thanksgiving, and so I figured I'd do a live Q&A, and so that way, kids and parents or grandparents and nieces and nephews and says, hey, I completely disagree with you politically, but I'm still your nephew or niece or son or daughter, and let's talk to Dr. Ed and make sure you're getting everything from Social Security. So a little peace offering out there. We had some views. I don't think I'm going to do that this year, so I think I'm actually going to
take Thanksgiving off too.
Eat some, what is it, tryptophan or whatever that's in the turkey that supposedly puts you to sleep. I think it's just a matter of eating too much. But anyway,
Americans aren't eating as much turkey, I read.
Yeah.
Turkey consumption is way down.
It's actually a lot healthier, right? I have a Cigna PPO supplement. It covers 20%. Is it okay? What would you say to that?
Depends on your 3 Ps. So let's go over the 3 Ps. Your providers. We need to make sure that all of your doctors are in network. All of the institutions you'd want to go to are in network. If they're not, you're going to pay more. So even under a PPO, you can still go to an out-of-network doctor, but you're going to pay more when you see that out-of-network doctor. The second P is your prescriptions. What medications do you take, brand name or generic? What pharmacy do you like to go to? And then the third P is your priorities. M. Garcia, what's important to you? Do you own an RV and love to hit the road? Do you snowbird in a different state like Florida or Arizona? Do your grandchildren live elsewhere and you would want to see a specialist when you visit them? All of that are things we would take into consideration when discussing your coverage one-on-one. And then we search every insurance company and every plan in order to find the right one for you. So it sounds like this plan has worked well for you for the past year. That's great. Let's see if it's the right one for you for 2026. And we have until December 7th in order to help you with that evaluation.
What about second opinion? So if someone has reviewed a plan with someone else, can they still change it?
Absolutely. The way the annual enrollment period works is the last plan that is submitted is the plan that will begin on January 1st. You do not need to call your previous insurance company. Instead, that coverage will end December 31st, and your new coverage will begin January 1st.
All right. Medicare said if Advantage didn't do this guaranteed issue right, they're telling me to terminate everything. Medicare said SSDI probably let your broker handle it. I don't think Justin Chapter will call tonight. Yeah, I'm not sure.
Send Dr. Ed an email, and let's look into this one. I would just need to see. It sounds like you've already been speaking with us, and would just like to take a look here.
Yeah, so send me an email. It's ed@mygovexpert.com, and just say, hey, this is Smilin from today's live, and here's the question I have, and I'll send it to Ari. Ari will check with Justin, and we'll make sure you're all set. Make sure you include your phone number down there because Chapter does it right. Unlike someone on the yesterday comment said they received 70 calls from Medicare agents the day before yesterday. 70 calls. They're not supposed to be calling. They're not supposed to be calling like that. If you didn't tell them to call you, they're not supposed to call you. So if you send me an email that says, Ed, tell Ari to call me, he's not going to call you until he confirms in the system that you called them first. So you need to include your phone number, and that way they can look it up in the system. And if they see you called them first, then they can call you back. So make sure you please add that. Does chapter work with WellCare for Medicare D plans, which is what I have currently?
We'd be more than happy to do a review of your coverage. What we do is we have every insurance company and every plan at the touch of our fingertips. Whether you've been on the right plan would just depend on the medications you're taking and the pharmacy that you want to go to.
Perfect. All right. Just want to clarify. I don't want to mess this up. There you go. I'm currently on an Advantage plan. January 2026, I'll be enrolled in Original Medicare and a Medigap N plan. I need to enroll in Medicare D by when?
December 7th.
Yes. And this is one that a lot of people mess up. Particularly, I think a lot more people are going to mess up this in the future because these health insurance companies aren't compensating brokers and agents to help you out with a lot of Part D plans. So if you sign up for a Medicare Advantage plan, most of those have Part D already bundled in there. They're called MAPDs, Medicare Advantage Part D. So they're already in there. If you get a Medicare supplement plan, a plan F, G, N, high deductible, whichever, then there is no prescription drug plan in there. You have to get what's called a standalone Part D plan. And historically, and I think even more so in the future, when you sign up for a plan N or G and the agent says, okay, now we got to go ahead and sign you up for Part D. And you say, well, I don't take drugs. I don't need to. And they say, okay, bye. Because they don't get paid to help you out.
That's not going to take you off your Medicare Advantage plan. And so then when January 1st rolls around, you're still going to be on that Medicare Advantage plan unless your coverage is ending. And then you're going to have two insurance plans. You're going to have the Medicare Advantage plan and in this case, Plan N. So you need to make sure that you sign up for that standalone prescription drug plan by the December 7th deadline. And that signing up for that standalone prescription drug plan will automatically take you off your Medicare Advantage plan at the end of the year.
That's right. I forgot that dimension. That's right. Yeah. If you already have a Medicare Advantage plan and it's continuing for next year, then it's automatically going to roll over till next year. The only way you can get out of that is enroll in another Medicare Advantage, which cancels out this year's, or a Part D. That's right. That's right. So if you don't sign up for a Part D by December 7th, then you're going to have two and you can't have both.
Dr. Ed, how frustrating is that someone would advise on Medicare supplement and then not help you with the drug plan?
Yeah.
So then you aren't aware that you need to do something with your Medicare Advantage plan. They didn't instruct you on which Part D plan to sign up for. And then January 1st rolls around and you haven't canceled your Medicare Advantage plan because you never submitted the application for your standalone prescription drug plan.
Yeah. So I think that's one of whoever advised that and didn't finish the entire thing. I think if that particular agent reached out to chapter to see if they could become a member of the chapter team, I think y'all would probably punt on that particular person.
Funny comment from Pink Owl Pink. I don't know why they made it $202.90. I wish they picked nice whole numbers like the 185 for this year.
Yeah, because it's going to be tough having to do that for 365 days every day. I do it live. $202.90. Don't forget the 90 cents, Ed. I think these health insurance companies need to stop playing doctor and let our doctors have their say in our care and keep it at that. Yes. Well, that's what you get with the Medicare supplement plan.
Thank you. Just about to go there.
Yep. Yeah. So with the Medicare, or if you stay with original Medicare, you have Part A, Part B, and you get a Medicare supplement, Medigap, NG, all the same. Medigap and Medicare supplement are the same. Then you don't have to deal with some insurance, bean counter actuary, double guessing, second guessing your doctor. So fight. Yes, absolutely. Let's see. The cheapest one available is I take no meds and age 66, no smoking, or is a good rule to follow to find and select.
It's not
So
just a question of your health at 66, it's a question of how your health might change over time. So in 46 states, you have a one-time opportunity to choose Medicare supplement without questions about pre-existing condition or your recent health history. Once you're outside that 6-month window, which is called your Medigap open enrollment period, then you're subject to an insurance company's questions about your health history. The only 4 states that are an exception here are New York, Connecticut, Massachusetts, and Maine. So they're all along the northern Atlantic seaboard. If you don't live in one of those 4 states, then what I would be thinking about is not just what your health is like at 66, but how your health might evolve into your 70s and 80s. Because actuarial tables suggest, Dr. Ed, how long do they suggest that someone who's 66 today will live?
the average for males is what, 78. Women is about 81 or 82. But people all mess that up. That's kind of the Social Security does it differently. If that's the total for a
Right.
child that's 0, they have a life expectancy of this. But once you hit a particular age, then it's all different. So if you've already made it to 60, then I think it's a lot. You've got a lot more time there. And people on this channel, because they're good human beings and they have good hearts, we're all going to live to at least 120 years old. That's the promise we made as a community. So we're gonna
I've
keep at
seen
it.
I've seen studies that suggest someone who's turning 65 today has a 50-50 shot of making it to 100.
Yep. I definitely agree. Let's see. The cheapest one available is I take no meds and at 66 no smoke. Okay, we already. Let's see here. I think if we sign up with a chapter agent, however, they are too busy to advocate or call for us for assistance, is there a special person or a service point of contact we could reach out to? So the person that usually finds your plan, that's not your member success team, or sometimes they work both, or how do y'all do that internally there?
You're always welcome to reach out to the advisor that you worked with at chapter. And separately, you're also supported by our member advocate team, which Sarah oversees. And Dr. Ed, you had Sarah on last week. The
Yep.
member advocate team will get to the bottom of any hiccup that comes up post-enrollment, whether that's getting your ID card, a question about a claims invoice. Those can be written in hieroglyphics. Sarah's team will help you decipher it. And of course, if you have a question about a copay at the pharmacy, call us. We'll help you get to the bottom of it.
So when y'all help them out find a plan, y'all send them some type of correspondence, email or snail mail or something like that, and says, "Here's your new plan, and if you need any help with being persistent for the rest of the year, you've given them another number for the member success teams, because it's not usually this number right here, wherever it is. Yeah, that
Right,
number,
it's a
right?
different number. Yes, the member success team has their own dedicated phone number.
Perfect. I don't have the actual guarantee. They merged 2 plans and shouldn't have. So this Advantage typed this to letter to give to a broker. Medicare said it to broker ASAP. Give it to a broker ASAP. Yeah. So those where they walk you from one plan to another, is that the same as canceling your previous plan if they just automatically switch you to another plan? Or if they're merging plans, do you get the same type of guaranteed issue in those particular cases?
You do not. It's not being crosswalked to a different plan option is not the same as your plan ending. So
So they
here, let's do a comparison between the plan that you're being crosswalked to, which they would have sent you an annual notice of change on, so that way you can see what you're being crosswalked to, versus all your other options, whether that's a Medicare supplement and a standalone prescription drug plan or a different Medicare Advantage plan. What people don't appreciate is that there's lots of competition in the Medicare Advantage universe. So even if you were on the single best fitting plan for 2025, it might not be the right plan for you for the upcoming year. The doctor networks change, the prescription copays change, and the plan coverage changes, in addition to your health changing.
All right. Let's see. Why did Sinatra? No. pull out of Medicare. I had a Medicare plan, but I had an insurance agent as a friend to help me find another insurance. I'm thankful. Yeah. If you've got someone in your family, a brother, a son, a nephew, a niece, or something like that, it's also a Medicare insurance agent. I mean, yeah, it's coming up to Thanksgiving. You definitely got to use them. So,
Yeah, you're going to see them
uh,
on Thursday.
exactly. So hopefully they do everything right and take care of you. Absolutely. All right. I'm considering coming off my husband's work insurance because Aetna is not that good because it has high copays and denies a lot. It's a very scary time. I have a history of cancer, 11 years free. So is she, because she's had creditable health insurance from her husband's work, from hers or her husband's, and that employer had 20 more employees.
Perfect.
So what are her options?
You can start Medicare if you choose. And many people come off their work provided coverage, even if your spouse is planning to continue working, and start Medicare instead. What it would come down to is how much is the spousal premium for your work provided coverage. Oftentimes, the working employee is subsidized by the employer, but the non working spouse isn't subsidized at all, in which case you're paying an arm and a leg for your work provided coverage. Medicare is excellent health insurance. It might provide better coverage at a lower price than what you're getting from your spouse's work provided plan. So let's do an apples to apples comparison.
Now going to have Part A, B, and an Advantage plan. $165 offset to the B premium. Let's talk about that. And a number of meds at zero each. The other meds will be a low cost, saving somewhere between $3,000 and $5,000 a year. Thank you, Chapter. Okay, it sounds like you set up SoCal Fishman Semper Fi 5290. SoCal, you don't look a day over 250 years old. Hoorah, Marine Corps. Yeah, 250-year-old birthday. So, all right. So 165 offset on Part B. What is that?
So there are some Medicare Advantage plans that offer a Part B give back. This adds money to your Social Security. The availability of these plans will depend on the county and zip code that you live in. They're not offered everywhere. So it sounds like Mr. Semper Fi lives in an area which has this as a plan option. I would guess Southern California based on their handle. It just depends on where you live. And that can be a good option for you if you don't use very much healthcare. You always have to remember there are trade-offs though. In exchange for that Part B give back, you might not be getting as much dental coverage, for example, or you might have higher prescription copays. It just depends on your 3 Ps.
All right. I was told by Chapter that my nephrologist wouldn't cover my Medicare plan. I called the doctor's office and they said they would. Is that true?
Source of truth is going to be what your doctor communicates to you, what their insurance coordinator communicates to you. So if your nephrologist said that they would accept the plan, then that's what we should go with.
But it's the key that you said, the health insurance coordinator. So I've seen people that called up the doctor's office, talk to someone at the front, whoever picks up the phone and says, do you take XYZ company? And they say, oh yeah, we take that. Yep. Oh, okay. Well, I guess it covered. XYZ company, Medicare Advantage company might have 2, 3, 4, 5, 6, 7 plans in that particular area. And maybe they cover half of those, but the other half they don't for whatever reason. So
right,
you have to be careful on that sometimes.
Yes.
Chapter looks it up because you all look it up in the system to determine. And we've had people reach out to us and said, yes, I talked to whoever at Chapter, and they even called the doctor's office to triple check that it was covered.
That's exactly what we do as part of our protocol. And it's not just the doctor that you see, it's also the location where you see them. So a doctor might be in network at one location. Let's say we're in Cook County, Illinois. They might be in network at their downtown Chicago office, but out of network in the suburbs where they also see patients. So it also depends on the location where you see the provider.
Yeah, it's crazy. And you're like, oh, okay, the hospital is covered by this Medicare Advantage plan, and that doctor works in the hospital, So therefore,
Right.
no,
So now you bring
there
up an
is no,
interesting wrinkle.
there
If you're
is no
getting
therefore, right?
if you're getting a procedure, the doctor needs to accept the plan who you're planning to have the doctor who you're planning to have operate on you needs to accept the plan, and the institution where you're planning to have the procedure at also needs to accept the plan.
And I know Kobe, the guy that's you and Kobe and the team at Chapter are also going to Washington D.C. to try to change some of this stuff to make it easier for the consumer. So we definitely appreciate you doing that. We're doing our part
Absolutely.
here. If y'all ever need any backup for people to reach out to their, or political representatives, let us know. We do that on a regular basis and try to help people. So we definitely need to make the system a lot easier for people out there. My neighbor Betty signed up with Chapter last year in December. Since then has qualified. Number one, living it up daily. Thank you for looking out for your neighbor. You are too awesome. Since then has qualified for QMB and was switched to Medicare Advantage. It's been less than a year. She wants to go back to original Medicare. Is that possible now?
Yes, now would be the time. Would be curious what level of Medicaid they received, because there are
QMB.
levels. Thank you. Qualified Medicaid beneficiary. But even then, there are levels. Is it QMB plus or is it QMB only? There are levels here. So that would be something else to look into. Here are the questions that I would have. First, who pays their Part B premium? Is it being deducted from their Social Security, or is the state paying for their Part B? Second, when they go to the doctors, do they have copays or coinsurance? If they're a full Medicaid recipient, then they're cost share protected. So those would be the questions that I would have. And that's something that we would want to investigate to make sure that we match their level of Medicaid with the right plan, whether that's going back to original Medicare or choosing a Medicare Advantage plan that coordinates benefits between Medicare and Medicaid.
So yeah, your neighbor, if they go back to original Medicare, then they're going to have, with QMB, there's a she's probably getting her Part B paid for. So that's $185. If she has a Medicare Advantage, she may or may not have one of those grocery cards, those over-the-counter drug cards. They're kind of, one of the programs is disappearing there. So she might lose that one. She might lose some other cost sharing. And if she goes back to original Medicare, then that means she wants to get a Medicare supplement, which is going to cost her another $100 or so. So this might be an extra $300 or $400 a month ordeal for her. And if she's receiving QMB, that means she's receiving Medicaid from the state. She just might not be able to, have that in her budget, an extra $400, $500, $600 a month for that.
Means one more thing too. They also are receiving extra help for their prescriptions.
Yes. Yep. From Social Security, from Medicare. You sign up for extra help with the prescription drugs through Social Security. It's saves a lot of people a lot of money. She can, just have Medicare and Medicaid without signing up for a Medicare supplement plan. Some people do that. They're just good with Medicare and Medicaid. So there's that. So I would definitely have her reach out to Chapter there since last year, and things have changed. And yeah, have them check out all the options. Let's see. Does Chapter help with choosing Part D and make sure prescription best prices?
Absolutely. When we do a review of your coverage.
Let's see. Why is an MRI less than $100 with just A and B, but $200 for the same MRI on Advantage? I thought it was supposed to cover the 20% gap.
So Medicare Advantage is a replacement for original Medicare administered by a private insurance company. And so here you're either going to owe copays or coinsurance for most medical services that you receive. And for the plan that it sounds like Dargar 2450 is on, I can't see the user handle too well.
Dargar 2450.
It sounds like The Medicare Advantage plan that you're on, you have a copay of $200 for diagnostic radiological services such as an MRI or a CT scan.
And this, yeah, I mean, I'm not sure if it applies to you, but that's one of the issues with the entire industry. You know, why can you go to the doctor and pay cash and pay $50, and then if say, well, if you use insurance, it's going to cost $500? Yeah, that's logic that Ari and I don't think you can. You understand that?
Mystifying.
Okay,
Mystifying.
yeah. So we're in there.
I think
Dr.
about
Ed,
it all the
why
time.
do you, yeah, why do you prefer Plan N over Plan G? Because I'm cheap and I'm healthy-ish right now. I'm not at that age yet, even though I look like I'm 20 years past that age. Thank you very much. Anyway, but yeah, if I was going to choose a plan today, I would choose a Medicare Supplement Plan N. It covers, it covers the 20%. It's the monthly premium is usually about 20 or 30% cheaper. But if I wasn't healthy, then I would probably go ahead and or I was, thinking I, might have issues in the future, then I would probably go with a Plan G. A little bit more, but it covers more. It doesn't have the excess charges, which I don't think is an issue anyway. If there's plenty of doctors in my area that don't charge excess charges, so that's not an issue. Yeah. The only thing is they can charge up to a Plan N. If you have a Plan N, if you go to a doctor and it's limited, procedures or limited issues, that you have to pay up to $20 if you go see a doctor for kind of a consultation. If you go to the emergency room, you pay up to $50 unless you're admitted to the hospital.
Yep.
But
3 differences between Plan N and Plan G. With Plan N, you may have a copay of $20 when you go to the doctor. Plan N, second difference, $50 copay if you go to the emergency room and you aren't admitted within 24 hours. If you are admitted, that $50 is refunded to you. And then the third difference is if your provider doesn't accept the Medicare assigned amount, then you can be passed on an excess charge of up to 15%, depending on the state where you live. Under Plan G, there's no excess charge.
And next year, the deductible. So if you have a Plan G and you have $1 million procedure, then you have to pay obviously your monthly premium, and then you have a deductible of $283 for 2026, and you're done. And then Medicare pays the other $999,900, whatever. So
I mean, that blows my mind to have a deductible of $283 and for that to also be your maximum out of pocket. I can't wait to be on Medicare. I have a $6,000 deductible for my wife, daughter, and I. And our maximum out of pocket is over $10,000. So to have a $283 deductible on the calendar year, and for that also to be our maximum out of pocket. Now it's individual coverage. So each of us would have that $283 deductible, but still.
Yeah. Less than $1,000 for 3. Yeah. I have a dual advantage plan that had the $185 deducted for premiums. Well, I have to pay more in January. I get SSDI. So the $185 is not for the advantage premiums. That's for the Part B. So you pay $185 for Part B. So you're not paying that to your advantage plan. But okay, you have a dual advantage plan. So it looks like the state is paying possibly your $185.
That's how I read it, Dr. Ed.
Okay. So yeah, if they change it, they're changing it to $202.90. So if you still have dual advantage, and you continue to have the higher levels of Medicaid that your state participates in that Medicare savings program, then yeah, they will continue to pay it. And that's another thing that I think going forward, this is one of the things that our community is going to really focus on over the next year or two, are people that are going to be losing Medicaid. And it's not only those, 26-year-old kid playing PlayStation in the parents' basement. It's people that are working, people that are elderly, and they get caught up in the system. They don't fill out the documents correctly. They don't do it, in triplicate and, whatever bureaucratic barrier they're put up to kick them off Medicaid. I think that's going to be an issue. A lot of people are going to be kicked off Medicaid that are actually eligible. So that's what our community is going to be working over the next year or two. But when you're kicked off Medicaid, a whole cascade of craziness happens, right? So you lose Medicaid, and then even if you're downgraded, if you're the higher levels of Medicaid and they downgrade you, then they won't pay for your $185 or $202.90. And then if you lose Medicaid, what else are you going to lose?
You may also lose your extra help as well. It depends. Now, extra help is something you can separately apply for. So even if you earn too much to qualify for Medicaid, you can still reapply for extra help. And that can lower the cost of your prescriptions. It can help substantially with the cost of your prescriptions. For example, if you're on a brand name medication, that brand name medication, if you receive extra help, would be capped at a $12.65 copay if you're eligible for extra help. And it's a very quick and easy application process, as Dr. Ed often mentions, to apply for the low income subsidy through the Social Security Administration. It'll take you less than 5 to 10 minutes to complete.
That one's it's an unusual and very easy. You still have to buy, low income, low resources. It's extra help. It's another internal name for it is LIS, low income subsidy. So you lose the Medicare savings program, the $185. If you have a Medicare Advantage dual eligible plan, that means you have to find something else because you're no longer dual eligible. You're going to lose those cost savings, the help with the co-insurance. You might lose that. You're probably going to lose or be reduced considerably on that grocery card or over-the-counter drug card. Unfortunately, there's a lot of stuff that can happen. And that's one of the focuses we're going to do over the next years.
And for the grocery card benefit, I know that's come up on a couple occasions in today's Q&A. That process has changed a little bit. It's now called the Special Supplemental Benefit for the Chronically Ill. And as long as you have a qualifying condition, which your primary care doctor can attest to, then you should be able to qualify to continue if you've been depending, for example, on using that supplemental benefit to purchase healthy food at the grocery store, for example.
Yeah, they've our viewers have mentioned, most of them said it's either went away, their grocery cards or their over-the-counter went away, or it was reduced significantly. Probably about 20% of people said that it stayed the same or actually increased a little bit for 2026. So that's kind of what we're seeing out there. New to the system and good to know I am not under the December 7th window. I have an online app with chapter for December 17th. So enough time to find the choice best for me as a new Social Security individual. Yep. Perfect. Awesome. So if you're going to look for a Medicare Advantage plan, then remember those, have your doctors there and your prescriptions and all that kind of stuff. And that way you make sure you get the best one that's available for you. See any other questions here that we need to answer? Why am I here? Go for it.
Oh, go ahead. Please go ahead.
Why am I hearing that I should get rid of my Advantage plan and go back to original Medicare? Nobody, for my particular situation, Medicare supplement, for Ari, maybe Medicare supplement, but situation will change for us in the future. A lot of people that get a Medicare supplement when they're 65 and then at 75, they just can't afford it in their budget anymore. So they go to a Medicare Advantage. Nobody can tell you. I say it's like, are you a dog person or a truck, or a dog or a cat person, a truck person or a car person? It's on your particular situation. It's what you need and what is available in your area and your budget. So it really depends on you. It really depends on you. A little over 50% of people sign up for Medicare Advantage nowadays.
Question from a veteran. He's a retired service member. He's asking, which Medicare plan should I select? Thank you for your service to our country. If you're a retired service member, which means you served 20 years plus and retired with the Department of Defense, then you receive a $0 Medicare supplement plan as a thank you for your service. And you also receive excellent prescription drug coverage. All you need to do is activate your Medicare. That's it. Then you're done. Do not answer don't answer unsolicited phone calls anyways. Don't respond to those spam text messages. Don't respond to the Joe Namath, William Shatner, Jimmy Walker commercials. Those plans are not designed for your situation.
Yeah. Good. Yeah. And if you are signed up for Social Security for SSA.gov and you set up an account, another thing out there is if you receive an email that says, hey, we Social Security just put a new letter in your account, you need to click on this button, this link, to see what we're telling you. Don't click on that link. Delete it and said, oh, okay, well, it looks like I got a new message. Delete that email, go directly to SSA.gov and log in there directly. We see a lot of scams out there trying to, people click links and then there's issues. Isn't there another open enrollment in March? So that is the open enrollment period. It's actually January, February, March. What can they do then?
If you're already on a Medicare Advantage plan, then there is a second chance to adjust your coverage from January 1st to March 31st. This is called the Medicare Advantage Open Enrollment Period. It only applies to those people who are already on a Medicare Advantage plan, though.
So it's kind of a mulligan kind of situation where, oops, I picked the wrong one. You have one opportunity to switch, right?
That's right.
Cedric, does anyone monitor these comments in real time? No.
We try. We try.
Yeah. No, this is not some big organization. Well, Chapter's got a lot of staff there, but for the YouTube channel here that you're joining, it's just me and my son, and the best community on social media, and 99.9% of people are awesome, and they're always very respectful and nice and help each other out. If that changes in the future, then we might have to bring someone in to kick people out. So, but right now, everybody's super awesome. It's very unusual for social media. See such crazy stuff out there. Can I mail this PDF file my Advantage sent me about my guaranteed issue right letter? They say it will work. I think it's wrong saying I'm disenrolling in my Advantage, and I'm not. They terminated it.
That's right. So if your plan is ending, then the Medicare Advantage company that's ending your plan will have sent you a letter saying, hang on to this letter. This affords you a guaranteed issue right to purchase Medicare Supplement. Then if you want Medicare Supplement, we'll need to upload a copy of that letter to the Medicare Supplement insurer of your choosing. So definitely hang on to that letter, scan it, and we'll use that as proof so that you don't have to answer any questions about your recent health history. Alternatively, if you don't want Medicare Supplement, then you need to shop your options by the December 7th deadline to make sure that you have some protection for the 20% you'd otherwise owe out of pocket come January 1st, and so that you also have affordable prescription drug coverage.
Okay. All right. And Cedric said they left. I think, Cedric, I answered your question live yesterday. If you, I'm trying to recognize your face. I think you did do a video question, and I answered. I answer video questions. If you send a video question, you go onto my website. How you do that is you go onto mygovexpert.com and you click on the little camera icon and you can ask a video question. But I think, looking at your face, Cedric, I think I answered your question yesterday. I'm not answering any today because we got Ari. But if you recorded it and it wasn't answered yesterday, then I will answer your question 100%, definitely tomorrow. Yeah, I always answer those the next day unless we have an awesome guest like Ari here. All right. Any other questions that so complex?
Yeah, there's some chatter about the guaranteed issue letter. If you'd like a second opinion, we'd be more than happy to put eyes on it.
Yeah, and those are kind of the golden ticket. And if you the ANOC letter, people were supposed to get that annual notice of change letter by September 30th, right? September 30th.
Correct.
Okay. And if they didn't, then yeah, you definitely need to reach out to your company or whoever helped you, or reach out to Chapter. And even without the letter, they will be able to find your particular plan in your particular area. And they'll see if it's actually been canceled or whether it's still the best plan for next year. And
right,
we will all chip in to get Dr.
Oh
You're
my
e-
God. No, that's so mean. That's so mean.
no, time traveler is a regular one. So that's yeah. If you can't make fun of yourself, you're not allowed to make fun of anybody else. So that's the old Marine Corps thing. So, all right. So I think that's it. We're over an hour for today. If you've got any other questions, I'll be back again tomorrow. We'll do another topic tomorrow. I think we're talking about the attempt to the legislation in Congress to change COLA in the future. So we'll talk about that tomorrow. And if you've got any questions for Ari, definitely reach out to them. If you're having problems getting through, just email me, ed@mygovexpert.com, and I'll forward that to Ari. Make sure, again, you include your phone number because they always do it right over there. We sure do appreciate it, Ari. You are too awesome.
Thank you, Dr. Ed, for having me. And thank
All
you
right.
to all your viewers for their engagement tonight, their questions, and for those of us who have let us help you review your coverage for 2026.
And take off Thanksgiving.
We are taking off Thanksgiving.
Actually, take off. I mean, actually relax. Don't think about anything. Just have fun with your family, right?
I'm cooking the turkey this year. So
Oh, okay. There you go.
so
You're gonna
that's
be
a big
busy.
job.
Yes, it is. Okay, y'all take care. Have a beautiful night, and please, 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 please take care of each other. We'll see you tomorrow.